Hi, welcome to our channel of ignou audiobooks, Indira Gandhi National Open University, School of Social Sciences, SOSS, Master's Degree Programs, MA in Psychology, MAPC, Second Year, MPCE 0 to 3 Interventions in Counseling, Block-1 Psychological Interventions, Major Modalities, Unit-2 Insight and Short-Term Counseling, 2.0 Introduction. It has already been discussed what are the objectives of counseling in general along with one method of counseling has also been discussed earlier. It should be kept in mind always that there are several methods modalities in counseling clients. But all may not be applicable for at all the clients at all the times. Hence we discuss other modalities as well, which have usage for specific populations. Short-term counseling and insight counseling are our topic of discussion here. Counseling is an attempt to uncover the deep causes of the individual's problem and to help eliminate defense mechanisms. Counseling is the treatment of a personality disorder by attempting to uncover the deep causes of the individual's problem and to help eliminate defense mechanisms. 2.1 Objectives. On successful completion of this unit, you will be able to define insight as a counseling method, define insight counseling, describe various insight therapies, explain short-term counseling, elucidate the characteristics of short-term counseling, define brief therapy, and differentiate between short-term counseling and other modalities. 2.2 Insight as a counseling method, having the capacity to step outside of one's immediate experience and to think about oneself from the perspective of an observer is a very useful ingredient for most psychoanalytic and psychodynamic interventions. That is what insight is all about. Insight is a major goal of both psychoanalysis and psychodynamic psychotherapy, counseling, because of the belief that as people acquire a more realistic view of their motivations and the needs of other people, the likelihood of behavioral change increases. 2.2.1 Definition of insight. Insight is self-knowledge. Understanding the significance and purpose of one's motives or behavior, including the ability to recognize the inappropriateness and irrationality. 2.2.2 Definition of insight counseling. Insight is an integral process in both individual and group process where the client makes connection between new information generated in therapy and present circumstances. 2.2.3 Counseling and insight. Insight recognizes that the first step to solving any problem begins with asking the right questions. Psychologists help their clients to become aware of factors affecting their well-being and plan out a treatment program which is the most appropriate for the client's problem. Insight promotes the mental health of the clients by generating an awareness into their own conflicts and problems and how the same was caused and what could be done to overcome the same. Insight can help clients to realize their full potentials. Insight actually refers to the treatments involving complex conversations between therapists and clients. The treatment helps clients understand the nature of their problems and the meaning of their behavior, thoughts and feelings. In other words, it helps the person become aware of why he behaves as he does. Thus, insight therapy is an umbrella term used to describe a group of different therapy techniques that have some similar characteristics in theory and thought. Insight therapy assumes that a person's behavior, thoughts and emotions become disordered because the individual does not understand what motivates him, especially when a conflict develops between the person's needs and his drives. The theory of insight therapy, therefore, is that a greater awareness of motivation will result in an increase in control and an improvement in thought, emotion, and behavior. The goal of this therapy is to help an individual discover the reasons and motivation for his behavior, feelings, and thinking. The different types of insight therapies are described below. 2.2.4 Psychoanalysis. Freud believed that personal development is based on inborn, and particularly sexual, drives that exist in everyone. He also believed that the mind, or the psyche, is divided into three parts, namely the id, ego and the superego. These three parts function together as a whole, and these three parts represent specific energies in a person. Psychoanalytic theory and psychoanalysis are based on Freud's second theory of neurotic anxiety, which is the reaction of the ego when a previously repressed id impulse pushes it to express itself. The unconscious part of the ego, for example, encounters a situation that reminds it of a repressed childhood conflict, often related to a sexual or aggressive impulse, and is overcome by an overwhelming feeling of tension. Psychoanalytic therapy tries to remove the earlier repression and helps the patient resolve the childhood conflict through the use of adult reality. The childhood repression had prevented the ego from growing. As the conflict is faced and resolved, the ego can re-enter a healthy growth pattern. There are certain important psychoanalytic techniques such as free association, dream analysis, transference, etc. In free association, the client is free to express whatever he or she wants without inhibition. In the process, the client brings into the conscious many of the repressed materials which normally he cannot mention without feeling guilty or ashamed. Once these repressed materials come into the conscious, the therapist or the counselor is able to provide insight to the client regarding these materials and how these in turn are causing the various symptoms and problems. This insight helps the client to face the problem squarely and understand his or her own behaviors in terms of the root causes. Once the cause is known, the client is able to get over the problem. Thus, insight development in psychoanalysis through free association is undertaken. Another technique of psychoanalysis is what we call as the dream analysis. When a person sleeps, the repressed materials are allowed to enter the consciousness. However, as these repressed thoughts are threatening, they cannot be experienced in their actual form. The thoughts are disguised in dreams, which then become symbolic and significant to the client's psychoanalytic work. As the dreams are told and narrated to the counselor-therapist, the same is analyzed and interpreted by the therapist. As the dreams are interpreted, the therapist helps the client to develop insight into the causes of his problems as interpreted from the dreams. This insight helps the client to understand why he behaved as he did and thus change the behavior. Another technique of psychoanalysis is the transference. Through transference, the psychoanalyst gains insight into the childhood origin of repressed conflicts. 1. Focus of psychoanalysis is the analysis of defenses. This can provide the analyst a clear picture of some of the patient's conflict. The counselor studies the client's defense mechanisms, which are the ego's unconscious way of warding off a confrontation with anxiety. The counselor tries to interpret the client's behavior, pointing out its defensive nature in order to stimulate the client to realize that she is avoiding the topic. This insight helps the client to understand the underlying conflicts and helps overcome the problems and symptoms. 2.2.5 Humanistic and existential approach. These also fall under the category of insight therapies. These therapies are insight focused, and they are based on the assumption that disordered behavior can be overcome by increasing the awareness of the client of their motivation and needs. Humanistic and existential therapists counselors place more emphasis on a person's freedom of choice and believe that free will is a person's most valuable trait and is considered a gift to be used wisely. Analytical psychology organizes personality types into groups. The familiar terms extrovert or acting out, and introverted, or turning oneself inward, are Jungian terms used to describe personality traits. Developing a purpose, decision-making, and setting goals are other components of Jung's theory. Whereas Freud believed that a person's current and future behavior is based on experiences of the past, Jungian theorists often focus on dreams, fantasies, and other things that come from or involve the unconscious. Jungian therapy, then, focuses on an analysis of the patient's unconscious processes so the patient can ultimately integrate them into conscious thought and deal with them. Much of the Jungian technique is based on bringing the unconscious into the conscious. In explaining personality, Jung said there are 3 levels of consciousness: the conscious, the personal unconscious, and the collective unconscious. 2.2.6 Psychodynamic therapy. In 1946, psychodynamic therapy was developed in part through the work of Franz Gabriel Alexander, MD, and Thomas Morton French, MD, who were supporters of a briefer analytic therapy than Freud's psychoanalytic theory, using a present and more future-oriented approach. Influenced by such Freudian concepts as the defense mechanism and unconscious motivation, psychodynamic therapy is more active than Freudian therapy and focuses more on present problems and relationships than on childhood conflicts. Psychodynamic therapy slowly examines the true sources of client's tension and unhappiness by facing repressed feelings and eventually lifting that repression. The personal unconscious is the landing area of the brain for the thoughts, feelings, experiences, and perceptions that are not picked up by the ego. Repressed personal conflicts or unresolved issues are also stored here. Jung wove this concept into his psychoanalytic theory. Often thoughts, memories, and other material in the personal unconscious are associated with each other and form an involuntary theme. Jung assigned the term complex to describe this theme. These complexes can have an extreme emotional effect on a person. Jung believed that to fully understand people, one has to appreciate a person's dreams and not just his or her past experiences. Through analytical psychology, the therapist and patient work together to uncover both parts of the person and address conflicts existing in that person. 2.3 Adlerian psychology. Adler's view of personality stressed the importance of the person as a whole but also of the individual's interaction with surrounding society. He also saw the person as a goal-directed, creative individual responsible for his own future. He emphasized in his own theories of working toward superiority, but not in an antisocial sense. Instead, he viewed people as tied to their surroundings. Adler claimed that a person's fulfillment was based on doing things for the social good. Like Jung, Adler also argued the importance of working toward personal goals in therapy. The main factor in Adler's work was a focus on individual psychology or individual phenomenology, working to help patients get over the illogical expectations made on themselves and their lives. Crucial to the Adlerian therapy technique is the establishment of a good therapeutic relationship between therapist and patient, particularly one based on respect and mutual trust. One of the most important goals of Adlerian therapy is the patient's increase in social interests, as well as an increase in self-awareness and self-confidence. Adlerian therapy is a practical, humanistic therapy method that helps individuals to identify and change the dysfunction in their lives. 2.4 Existential therapy. Another insight therapy. Existential therapy is based on the philosophical theory of existentialism, which emphasizes the importance of existence, including one's responsibility for one's own psychological existence. One important component of this theory is dealing with life themes instead of techniques. more than other therapies, existential therapy looks at a patient's self-awareness and his ability to look beyond the immediate problems and events in his or her life and focus instead on problems of human existence. The first existential therapists were trained in Freud's theories of psychoanalysis, but they disagreed with Freud's stress on the importance of biological drives and unconscious processes in the psyche. Instead, these therapists saw their patients as they were in reality, not as subjects based on theory. With existential therapy, the focus is not on technique but on existential themes and how they apply to the patient. Through a positive, constructive therapeutic relationship between therapist and patient, existential therapy uncovers common themes occurring in the patient's life. Patients discover that they are not living their lives to the full potential and learn what they must do to realize their full capacity. The existential therapist must be fully aware of patients and their needs in order to help them attain that position of living to the full of their existence. As patients become more aware of themselves and the results of their actions, they take more responsibility for life and become more active. In this sense, this is a therapy that instills insight about the individual's behavior to himself or herself. 2.5 Person-centered therapy, once called non-directive therapy, the client-centered therapy, person-centered therapy, was developed by American psychologist Carl Rogers. Drawing from years of in-depth clinical research, Rogers's therapy is based on 4 stages, viz. I, the developmental stage, 2, the non-directive stage, 3, the client-centered stage, and 4, the person-centered stage. Person-centered therapy looks at assumptions made about human nature and how people can try to understand these assumptions. Like other humanistic therapists, Rogers believed that people should be responsible for themselves, even when they are troubled. Person-centered therapy takes a positive view of patients, believing that they tend to move toward being fully functioning instead of wallowing in their problems. Person-centered therapy is based more on a way of being rather than a therapy technique. It focuses on understanding and caring instead of diagnosis and advice. Rogers believed that change in the patient could take place if only a few criteria were met, which according to him were: 1. The patient must be anxious or incongruent, lacking harmony, and be in contact with the therapist. 2. The therapist must be genuine, that is, a therapist's words and feelings must agree. 3. The therapist must accept the client and care unconditionally for the client. 4. In addition, the therapist must understand the patient's thoughts and experiences and relay this understanding to the patient. If the patient is able to perceive these conditions offered by the therapist, then the therapeutic change in the patient will take place and personal growth and higher consciousness can be reached. In this manner, the patient develops an insight into his own conditions, the problems that are affecting him, and how to handle with his own efforts, etc. 2.6 Gestalt therapy. Gestalt psychology emerged from the work of Friedrich S. Perls, who felt that a focus on perception and on the development of the whole individual were important. This was attained by increasing the patient's awareness of unacknowledged feelings and becoming aware of parts of the patient's personality that had been previously denied. Gestalt therapy has both humanistic and existential aspects. Gestalt theory states that people are basically good and that this goodness should be allowed to show itself. Also, psychological problems originate in frustrations and denials of this innate goodness. Gestalt therapists focus on the creative aspects of people instead of their problematic parts. There is a focus on the patient in the therapy room, in the present, instead of a launching into the past. What is most important for the patient is what is happening in that room at that time. If the past enters a session and creates problems for the patient, it is brought into the present and discussed. The question of why is discouraged in Gestalt therapy because trying to find causes in the past is considered an attempt to escape the responsibility for decisions made in the present. The therapist plays a role. Too, patients are sometimes forced or even bullied into an awareness of every minute detail of the present situation. Gestaltists believed that awareness acted as a curative, so it is an integral part of this therapy process. The goal of Gestalt therapy is to help patients understand and accept their needs and fears as well as increase awareness of how they keep themselves from reaching their goals and taking care of their needs. Also, the Gestalt therapist strives to help the patient encounter the world in a non-judgmental way. Concentration on the here and now and on the patient as responsible for his or her actions and behavior is an end result. 2.7 Short-term counseling. There has been a lot of discussion and research into the question of what kind of couple receives the most benefit from the least amount of marriage counseling. In other words, what type of couples can get help the fastest in the least amount of sessions? Like any type of generalization, there are absolute exceptions. However, the following will generally receive and also benefit from short-term counseling, especially marriage counseling. Couples who are still in active love, couples who are open to therapy and change. However, short-term marriage counseling will not be of use to the following persons: couples who wait too long before seeking help, couples where one is already set on getting a divorce and are closed to suggestions that may save the marriage. Instead of looking at these items in terms of who benefits the least from short-term counseling, one could look at them instead in terms of what will benefit each the most. That is, there are different set of problems and require different solutions. Couples who have been waiting for a long time before entering into marriage counseling are couples who have had years to build bad habits and negative responses and behaviors. Habits that took years to form take time to change, and it would be not correct to assume otherwise. Couples who are still in love but need help resolving some marital issues are having a specific problem that can be addressed in specific ways with specific solutions, making this type of relationship perfect for short-term counseling. The basis of the short-term model of counseling. The short-term counseling model is based on the following principles. 2.7.1 A focus on a specific solution that the counselee wants to get. Most people want to focus on the problem, which means looking at the negative side of the issue. While problems cannot be ignored, success is better if the major effort is aimed at the solution to the situation. The counselee is the one who selects the focus or the preferable future. Counseling is about the counselee, not the counselor. This takes the pressure off the counselor to be the expert or the one who must figure out what is best for someone else. The counselor's task is to work with the counselee in moving to a creative solution. 2.7.2 A willingness to change. The basis for helping people is anchored in the understanding that people do have the ability to change. Change is inevitable in people's lives. When we recognize that change is always occurring and that people are continuously changing, we are much more likely to look for change in the client's lives. We also realize that people's problems are always changing. It is easy to slip into the misconception that change always means a radical 180-degree reversal. At the same time, it must be remembered that one does not make change in giant steps. In counseling, change is made in small, seemingly insignificant movements. Change is an action step. If a person takes even a tiny action of change, it means more change is possible. 2.7.3 A limited time frame. With the many time demands on a counselor, counseling must be kept in balance with other duties. Some people like to talk about their problems but do not really want to change. One of the hardest aspects of counseling for most counselors is setting the necessary limits on the relationship. Limits are worked out by the counselor, and it should be adhered to by both counselee and the counselor. In the long-term counseling, it is never helpful if limits are consistently ignored. Limit setting is, therefore, a part of all responsible counseling. What is a reasonable limitation? While there are always exceptions, generally 4 to 6 sessions should be a reasonable time frame in dealing with a single, focused solution. If more time is needed, a counselor may consider referring the counselee to someone who may be more qualified. 2.7.4 A commitment to spiritual development. A person's spiritual life is not an appendage tacked on, like buying an option on a new car. Our spiritual life is related to all aspects of our human existence. The master goal of counseling is the facilitation of psychological growth. This involves helping people to understand their problems and their lives in the light of their relationship to the others in their lives and to the counselor, and then to live more fully in this relationship. The counselor's ability to help others arises out of their personal commitment to grow in their relationship in their own life too. As we considered in the previous sections, the major goal of a counselor in a counseling process is to establish comfortable and positive relationship, facilitate communications, identify and verify the client concerns and plan with the client. 2. Obtain assessment data needed to proceed with counseling process. As far as the client is concerned, his or her major goal is to share and amplify reasons for seeking counseling and cooperate in the assessment of both the problem and self. For both the purposes, a related concept that is important to assess early in treatment is patient's ability to have some insight. Insight is skills in a constructive way to obtain a new understanding of the problems and difficulties that had not been consciously realized before by the client. Sometimes counselors may provide a relatively benign interpretive comment early in treatment to assess the client or patient's readiness, willingness and capacity for insight. 1 year 1998. Although such interventions must be very carefully timed and crafted, they may allow counselors to get a feeling of how likely patients, clients, will engage in obtaining new levels of understanding. In fact, it is often the case that simply summarizing for clients what they have said in ways to draw an association between two important ideas will provide an opportunity to assess how insightful they are. Metallization and insight, as described by Fonagy and colleagues, Fonagy Target, 1996, 1997, Fonagy, Jurgely, Jurist Target, 2002. Mentalization or reflective capacity is the ability of patients to conceive of and to understand their mental states and that of others as an understandable causative mechanism of behavior and experience. Mentalization means to perceive and communicate mental states, such as beliefs, desires, plans, and goals. Mental states are unobservable constructs that must be inferred by observers rather than perceived directly. Most of us know what an ego is, and we probably have run into one that is inflated, but no one has ever perceived an ego directly. Even your own ego has to be inferred. Mentalization is largely communication outside of language. Mentalization draws heavily from context or the implications of an environment. A gun in a display case will have a different implicit sense to it than a gun being held by a police officer or soldier. We need to be able to mentalize in order to get the implicit meaning of things. Mentalization is necessary to get the meaning behind metaphor. Metaphor accurately depicts the nature of a situation, the objective reality, and is designed to convey a mental state. Infants are born with an imitative brain. In other words, infants are born with an innate desire to imitate a social partner. Imitation is the seed that will eventually, if all goes well, bear mentalizing fruit. To use a metaphor. Empathy is a form of mentalization. It is difficult to be empathetic, sympathetic maybe, without the ability to mentalize. Researchers, such as Russell Barkley, 1997, are looking at a possible connection between certain forms of ADHD and an impaired capacity to mentalize. The same brain regions are activated during imitation and mentalization. Mentalization is a way to find social partners in the world. Mentalization is necessary for the development of a fully developed sense of self and acquired in the context of early attachments, specifically primary object relationships. It is typically the case that the more severe a person's psychopathology, the more poorly developed is his/her reflective capacity, mentalization. When patients show very little awareness or recognition of their mental states or inner life, this should be a sign to therapists that more expressive interventions may not be appropriate or well received at this time, and that supportive interventions are indicated. The range of interventions would involve reflection and attention by the therapist to signs of patients' mental state and their psychological symptoms. By way of contrast, patients with greater levels of mentalization are more likely to come in with some ideas about what is going on in their minds or in the behaviors of others that could be contributing to their difficulties. It is not the case that patients have to have highly well-developed mentalization capacities for psychoanalytic and psychodynamic interventions to be successful, particularly with interventions targeted toward current life situations. However, an indicator of patients' abilities to improve with psychoanalytic or psychodynamic treatment is related to mentalization. Therefore, to make good decisions about how to proceed with treatment, it is necessary to assess patients' psychological well-being and ways of functioning. This can be done by evaluating the capacity for insight or reflective functioning. Psychodynamic psychotherapy is also known as an insight approach because it is the practice of exploring deeply the inner workings of the mind, how the psyche actually works. Old, unresolved conflicts and beliefs drain energy from people. By using an insight approach, the counselor intends to understand the places in the psyche where one has got stuck so that the stuckness, the inability to move forward in life, can relax with the awareness of new options. When a person really sees that now, in the current life, he or she has actually fresh possibilities for action, the old painful dilemmas naturally melt away. To make permanent change in the reoccurrence of depression and anxiety, it is important to combine insight therapy with the skill building of CBT and mindfulness training. This will lead to relatively more permanent change, also known as psychodynamic psychotherapy. Insight therapy is a technique which assumes that a person's behavior, thoughts, and emotions become disordered as a result of the individual's lack of understanding as to what motivates him or her, such as unresolved old conflicts or beliefs. The idea behind this therapy is that the therapist will help the client become more aware of themselves and therefore the client can go on to live a more full life. Example, a clinician trained in insight therapy helps his client to realize and break free of undesirable old patterns by examining how the man has reacted to certain situations in the past. 2.7.5 Short-term counseling, a 6-session model. Short-term counseling in an occupational health setting is an effective means of reaching a population that may otherwise not have considered counseling. However, because of the time limits, the practitioner must be able to make a quick assessment of the kind of help needed. The 7 principles of short-term treatment are 1. Mutual goal-directedness, 2. Quick problem identification, 3. Reminder of finiteness of sessions, 4. Making an appropriate referral, 5. Confidentiality, 6. Open communication, and 7. Follow-up. In a 6-session model, Sessions 1 and 2 are for assessment, Sessions 3 and 4 are for development of insights and strategies, Sessions 5 and 6 are for termination. Occupational health nurses with mental health training are ideal practitioners of short-term counseling because they can recognize many physical symptoms as having a psychological basis. Researchers report that a brief behavioral treatment appears to alleviate insomnia in older adults for at least 6 months. The intervention consisted of 2 in-person sessions and 2 phone calls. Even though pharmacologic and behavioral treatments are approximately equally effective, older adults are prescribed hypnotic agents at disproportionate rates and are also more likely than younger patients to experience adverse drug effects. Daniel J. Bice, MD, of the University of Pittsburgh School of Medicine, and colleagues conducted a randomized clinical trial of a brief behavioral treatment involving 79 older adults, average age 71.7, with insomnia. 39 received the treatment, consisting of individualized behavioral instruction delivered by a nurse clinician over 4 sessions, 2 in person and 2 by phone. The other 40 were assigned to an information control group and received only general, printed educational material about insomnia and sleep habits. All participants provided demographic information, completed self-report and interviewer-administered questionnaires about sleep habits, kept 2-week sleep diaries and underwent sleep assessment by actigraphy using a wrist or ankle monitor and polysomnography, a more in-depth monitoring procedure before treatment and 4 weeks after. Beginning therapy, participants who showed a response to the brief treatment were contacted again after 6 months and asked to complete questionnaires and sleep diaries. After 4 weeks, a larger percentage of those receiving the brief behavioral treatment showed a favorable response to the treatment, 67% versus 25%, or were classified as no longer having insomnia, 55% versus 13%. Recent years have witnessed increased interest in and practice of short-term counseling, brief therapy. In practice, brief therapy is probably as old as therapy itself. However, it has only recently been recognized and written about as a viable approach for the delivery of counseling assistance. Many studies indicate that short-term therapy is at least as effective as long-term, if not more so, produces lasting or durable results, and more frequently responsible to the client's anticipation of treatment. Line 2.7.6 Meaning and definition of brief therapy. Brief therapy, short-term therapy, time-limited therapy, making time a defining element in the psychotherapy relationship. The meaning of brief is relative to what is considered long or typical. A typical course of classical psychoanalysis often involved 3 to 5 years of treatment, with 2 to 3 sessions a week. 4 and 5 sessions a week might occur by were unusual in standard practice, as was once a week treatment. More than a precise number of sessions or duration of treatment, the critical feature of the briefer therapies is that time becomes an explicit defining feature in the therapeutic contract. Implicit in this type of therapy is the clear view of the starting and ending point and the pathway that will lead from one to the other. Open-ended Therapy contacts are defined by broad, mutually agreed upon goals but do not specify the rate of change that is the outcome. 2.7.7 Developments that influenced brief therapies. Several developments contributed to the interest in briefer therapies over the past several decades. Much of the identifiable change in psychotherapy occurred within the first 10 sessions. Increasing interest in how to make psychotherapy available to larger segments of society meet the need. Demand for psychological services, economic incentives favoring briefer therapies, increased interest in so-called symptomatic treatments such as behavior therapy, marital counseling, problem-solving strategies which focused on specific treatments goals rather than change of basic personality patterns traits. Continuing developments have bolstered interest in briefer therapies. Managed care strongly encouraged briefer treatments. Highly structured, especially manualized treatments have become a principal focus of psychotherapy outcome research. The brief therapies were easily adaptable to this model of research. Empirical evidence supporting the effectiveness of brief therapies accumulated. Virtually all therapeutic models and schools have been able to offer brief therapy alternatives such as psychoanalytic psychodynamic object relations therapy, solution-focused narrative therapy, cognitive behavioral therapy, etc. The major of presenting problems can be approached from a brief therapy model. Most presenting concerns of individuals, work with adolescents, couple counseling, crisis intervention, group therapy, parent training, family therapy. 2.7.8 Common aspects to many brief therapies. Problem solution versus pathology understanding focus. Active involved versus passive reserved therapist. Active experimental versus passive receptive client. Sharply focused and delimited therapeutic goals. Therapeutic emphasis on the power of thought, image and language for change. Utilization of life beyond the therapy session in the process of change. Descriptions of short term seem to vary somewhat, but it seems to be in the range of 1 to 5 sessions with the average length of 1 hour. The process itself is characterized by specific population for whom short-term counseling (STC) is used. Counselors in nearly all settings deal with a variety of individual problems and concerns. STC may be used for these special client populations. I. People who abuse drugs. 2. People who use tobacco. 3. People who abuse alcohol. 4. People with disabilities. Women. 6. Victims of abuse. 7. Older adults. Use of short-term counseling for child victim of sexual abuse, a case. Finding key safe persons for the child and building rapport and trust are key elements. At the outside of treatment, the child's safe person can serve as a bridging tool in the following ways: preparing the child for counseling, exhibit stability, support the child throughout counseling, come to the actual counseling sessions with the child, help the child express feelings and contents if needed, protect the child from the abuser family home life, client's concerns in STC for whom STC is used, inability to trust others, removal from home or removal of offender, guilt, shame, stigma, disclosure, loss of family and friends, healing from physical and sexual injuries, misunderstanding of what is happening to them emotionally, damaged goods syndrome, helplessness, lack of control. 2.8 Summary. We have discussed the different counseling modalities, i.e. insight counseling and short-term counseling, in what conditions they may be used and how they are useful. We have also brought forth the type of client for whom these counseling techniques are more trusted. The characteristics of both modalities have also been explained. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.